You're listening to The Support Report with Be Present, where we share real stories from young adults and how support changed their lives.
Hey, thanks for tuning in to another episode of The Support Report. We are Be Present. I'm your host, Justin Peters, joined as always by my lovely co-host, Kiara Riga. Kiara, how are you?
I'm doing all right, Justin. How's it going?
I'm doing great. It's been a while since we've been on mic together, I feel like. Hopefully
It
we're not too
has
rusty
been.
here.
Yeah, I know.
I don't know if you've been keeping up with the blog over at b-present.org, but they recently had a blog post out there that got published called Foods to Avoid While Undergoing Cancer Treatment, a Guide for Supporters. I read that today, and I was kind of curious. A few things actually shocked me, or at least you know me, I'm just like somewhat unaware being the supporter over here. I don't know if you had a chance to go through that blog post. Anything that you want to underline or kind of call out as, you know, especially personal to you, or like, holy cow, like one thing for me in particular, I didn't even think about raw or undercooked foods in terms of being immunocompromised. Like, once again, it made sense whenever I read that, but what did you get from that article?
Yeah, so the raw and undercooked foods has been like the biggest one for me. Obviously, like I will eat like a lettuce or something if I'm not neutropenic, but if my blood counts drop below a certain level, then like I'm not eating anything raw. Like everything I eat has to be cooked and like safe. And I feel like people don't really realize that. But I think so I just had surgery on my liver a couple of months ago, and eating now has been a bit more of a challenge as I'm like recovering. And so like the spicy and highly seasoned foods and the greasy and fatty foods are the ones that I'm really struggling with now. And especially like spicy and highly spiced. That is my favorite food. Like ask my fiance what my favorite food was, and he would probably tell you anything with fresh herbs. Like I love like a lot of flavor, but it can be really tough.
Ugh.
And yeah,
What are you defaulting to now? Do you have a favorite meal?
PB&J.
Oh no.
I haven't been super hungry, so it's just like a good way to get some protein in me.
Yeah,
But
that's
yeah,
fair. So yeah, I will read through these real quick. So raw and undercooked foods was the one that I called out. Spicy and highly seasoned food, high fiber foods, which once again, that was another one that I never really thought too much about.
that one is highly dependent on how your treatment affects you. If you're getting like diarrhea or stomach cramps from your treatment, then yeah, avoid it. I've been told to take it because most chemos will give either diarrhea or constipation. And yeah, so it's that one's not like for sure for everybody, but
That makes sense. Greasy and fatty foods, sugary foods, alcohol. Is alcohol good in any scenario? Like, I gotta imagine that one's out. Acidic food
yeah.
and caffeine, which caffeine's kind of a bummer as well. That would have been something I would have thought as a supporter to maybe bring a friend would be, you know, their favorite Starbucks drink or something. I didn't really think about maybe avoiding caffeine.
Yeah, it's such a common thing that people would bring something like that as like a comfort thing. And I don't think it's like a cut and dry. Like I've seen many a cancer patient drink a coffee, but it's hard to stay hydrated. I've started this new chemo after my surgery, and no matter how much I drink, I am still dehydrated. I've been having like a minimum of three, like 40-ounce Stanley cups a day, and I'm still like parched. So if you add caffeine to the mix and other things that dehydrate you, it just makes it really, really difficult.
You're a Stanley girl?
Yeah.
You got the handle one, or which one do you have?
Yeah, I have the handle one.
I love that they're so popular now. My girlfriend, I think she has that, and then the other brand that starts with an O, I'm blanking on it. It's like Oahu.
Awala.
Yeah, Awala. That's right. She loves all those. We have, I don't know, way too many cups to imagine right now. I'm just like tried and true Nalgene cup right here. I don't know. Maybe I'll get into the other ones at some point in time. But speaking of getting into it, we got a guest with us today. You mind sharing the bio and introducing who's on the call with us today?
Absolutely. I am so excited for today's guest. So, joining us today is Catherine Benedict. She is a clinical associate professor of psychiatry and behavioral sciences at Stanford University School of Medicine, and she was the lead investigator on a clinical trial called Roadmap to Parenthood. Her research focuses on improving cancer survivorship through a better understanding of late and long-term effects, unmet needs, and preferences for support. Catherine, welcome to the podcast.
Thank you so much for having me. I'm honored to be here.
Oh, we're so glad to have you. Do you want to, obviously that was very high level. Do you want to introduce yourself a little bit?
Yeah, I'd love to. So I am at Stanford. I am a clinical psychologist there. One of my specialties, so I sort of have two overlapping areas within cancer, and that is working with young adults and all the ways that cancer impacts a young adult, which is quite different than pediatric cancers and older adults, and women's health issues, so sexual and reproductive health. And today, I'll talk a lot about fertility and family building after cancer, but that's a lot of the work I do, both clinically and research-wise at Stanford.
How'd you get into this line of work? Did you imagine yourself kind of doing a lot of research around cancer, or was this something you tripped into?
Oh gosh. Okay. So there's the short answer and the long answer.
Let's go long answer.
The long answer. I'll take you on my journey. When I was fresh out of undergrad, my first job was as a research assistant in a hospital in Boston. And I had no idea what I wanted to do in my life. But I saw a lot of stuff happening in the hospital. And I asked the doctor I was working with, who was like leading the research at the time, if I could shadow him as he went on his rounds. And at the time we were in the Department of Infectious Diseases. And so often his rounds were to cancer patients, to the oncology floors, who were the patients who were having infections that the primary team couldn't get a handle of. And, I was sort of this 22-year-old. I would borrow a coat from one of the nurses, and I'd just kind of stand in the background, and all of the other doctors in the room, they all huddle up, right? And they're like sort of giving me the side eye. Who is this kid here? We don't know who she is, but I'd just be quiet, standing in the corner. And what I realized was that, I would enter the room, the patient's room, and they'd be there with their family, with their spouse, with their kids. And I was so fascinated with the emotional context of what was happening, and that it was so often not entirely related to the disease factors or the prognosis, right? So we'd walk into a room and we're talking about, really end of life stage disease, but they are holding hands with their spouse and they're laughing and they're making jokes with the team. And we'd go into another room and it's, they're about to walk out of here healthy, fixed, and yet they're angry, they're yelling at the nurses, there's discord, right? And we'd walk back out and the doctors would huddle, and as is their job, they would focus on all the medical factors and the treatment decisions that need to be made. And my head was still in the room of, these people clearly need more support, or some of them did, right? What is happening here where some are okay and some are not? So that started my journey to grad school to become a psychologist, focusing on health psychology and all of the medical situations that people find themselves in. And really early in grad school, was focusing on cancer and cancer survivorship. But what brought me specifically to our conversation today was I was working again in a different cancer hospital in New York, focusing on women's health issues, and started working with the fertility nurse they had there. So this was a single nurse dedicated to counseling patients newly diagnosed about all of the ways in which their treatments might impact their fertility and ability to have a child in the future. And this was at the time, this is now, over a decade ago. At the time, this was still a newish topic. Embryo freezing had been around for a while, but egg freezing was relatively new as being considered a non-experimental option. There was still sort of this push to make all oncologists aware that this was an important topic, right? That we have to be thinking about the quality of life after treatment's done. We're not just solving the cancer, we're also thinking about their life beyond. And that at the time, so the hospital was sort of ahead of its time, even having a fertility nurse. And what we noticed was that we were doing a fairly good job at providing that counseling to newly diagnosed patients and making them aware before their treatment started, which is absolutely necessary and important and good. And then we would have patients, go off and live their life as they should, getting back to living and all the things that are important. And they'd come back years later and say, now I'm ready to have a child. I'm ready to build my family. I've gone off, I've gone to college, I've gotten married, now I'm ready. And at that point, for a lot of them, it was either too late. They had entered premature menopause because of some of the treatment effects, often the chemotherapies, but other treatments as well. Or the path to parenthood was going to be more difficult than they expected. And it was sort of this, just this terrible avalanche of bad news where they weren't expecting all of these challenges and barriers. And we realized that, the world of cancer it was in the process of doing, sounding the alarm that these conversations had to happen at diagnosis and before treatment started. But the follow through, the ongoing conversation where they check in with their patients about how their life was going and what they wanted for their future, and checking in with them about the things they could do related to fertility and family building was falling off. And there was all these gaps in care. And so that started this research over 10 years ago. We did a number of studies then I can talk about. I can go into all the details, but that really started this research where we were seeing that there were gaps and there were unmet needs and patients were not being served.
Yeah, we've definitely talked about fertility a number of times on different episodes, but I honestly hadn't heard of too many fertility nurses. Did you have a fertility nurse? And that's what I thought. That never came up.
Yeah, I never had access to that. I'm not mainly treated at a research hospital. I'm treated in the community, and so that can make a big difference. But it was just sort of like they said, oh, if you want to think about fertility preservation, we can send you somewhere. But then as soon as for me, it's a little different, right? Because I was diagnosed metastatic, from the jump. And so with that kind of shortened lifespan, can I and do I feel right about having a family? But that's all part of it, right?
Absolutely. And you are entitled to information and to have that conversation and to have questions answered, right? And so it's so unfortunate that doctors will make these snap judgments depending on diagnosis or disease stage or prognosis, right? But you are entitled to that information. And whatever the reality is, first of all, I have patients who are metastatic who do decide to have children. That's a whole decision-making that's a personal, journey to go on. But that's not for the doctor to decide, right? They need to provide you with the information and offer a conversation and counseling and resources. Yeah, absolutely. But I think you're right that if having a fertility nurse is unique, often there's some nurse that sort of is the one in charge, who sort of has been trained, kind of feels comfortable having these conversations, but often there's not, and there's, especially in community settings, a lot of that falls through the cracks. And it's sort of the old adage of, they're there to treat the cancer and you should be grateful to be alive, or grateful. And this is what I tell my patients all the time. I just said this about 2 hours ago with a patient. Remember, two things can be true at once. You can absolutely be grateful to be alive, and you can also want to fulfill all of your life goals and be upset if you were not informed about, your treatment side effects. You can feel all of those things. All of those things can be true at once.
Yeah, absolutely. I mean, I've spoken to people who fertility was never even mentioned. It wasn't even we'll refer you out if we need to. And one of my friend's husbands was a childhood cancer survivor, and he did not know, now as an adult trying to start a family, he did not know that his childhood treatment affected his fertility.
It's such a shame. And there's a lot of work that needs to be done. Again, pushing out there that this is an absolute non-negotiable topic that needs to come up, and providers need to be the ones that bring it up, right? The onus is not on the patient to be able to come up with all of, what could possibly have happened. You depend on your providers to bring this up. There's a lot of work that needs to be done there. And my research actually focuses a lot on the patient side of things, including self-advocacy, but we're moving in the direction of how do we get this into the hands of providers, and not just cancer providers, not just your oncologist, but primary care, gynecology, right? There's a lot of touch points with the health system, and everybody should sort of know your history and be able to have these conversations.
Yeah,
absolutely.
If you don't mind, Catherine, can we open up the conversation a little bit larger and just kind of talk through some of the unique family planning, parenthood challenges. Of course, there could potentially be fertility issues. Anything else that you would like to bring up in this conversation?
Well, so there's certainly a lot to think about as you go through your cancer experience, it changes who you are, right? And so there is, broadly speaking, a lot to think about of who you are and how you want to parent and all that. My research focuses more on the decision-making around fertility and reproductive health care after treatment, and how do you make decisions around family building options? Because family building might look a little bit different than you had previously expected, or just sort of defaulted, expected it to go. And so here I'm thinking through, the ways in which treatment impacted your body and your reproductive potential and capability, whether you're able to carry a pregnancy, whether that child is able to be biologically related to you because you still have eggs or sperm, what are the options here? And how do you make decisions around those options? And those options are, not just biologically related children, but thinking through donor gametes, donor eggs, donor sperm, donor embryo, surrogacy if you're unable to carry a pregnancy or there's health risks associated with it, adoption and fostering, right? So family building can look the path to family building can look a lot of different ways. There's also a lot of emotions that go into it, right? And so how do you support survivors in thinking through these topics when they can feel really overwhelming, really upsetting? Sometimes there's anger, there's grief to work through, right? And then there's also just a number of logistical and barriers, depending on where you live in this country and what's legal, depending on your gender identity, sexual orientation, and your family makeup. And then a piece that I'm really passionate about is the financial piece. And unfortunately, in this country, family building, when it's medically assisted, adoption even is really, really expensive, and the financial barriers can be so high. And so that's why all of this combined, both for medical reasons, for financial reasons, for emotional reasons, to be able to adjust your expectations. Our whole premise is having those conversations started really early on, so that you're informed that the path ahead can be a little bit challenging, but that there can be hope and potential here, right? But you can get started early and plan and prepare for the future. So that's sort of the whole premise of this work. Again, so that we're closing the gap where it's not just a conversation at diagnosis and then 10 years later, I'm ready to have a kid, tell me what to do. But for those 10 years, you can be thinking, you can be handling those emotions. You can be adjusting expectations. You can be planning financially, having conversations with your doctor, having conversations with your partner of what is acceptable, what are our priorities, values, and goals when it comes to having a child. And those are complicated to think about, right? If you've never been forced to consider alternative family building, you sort of just default, it's going to go this way. There's sort of one path that our culture expects. And so adjusting psychologically that'll look different, and then learning all about it. And then finally, I'll just say, depending on the legal landscape, the insurance mandates, depending on the state you live in, it can also look really different. Sometimes you have to cross state borders, right? There could be a lot to think about.
It's absolutely insane.
Yeah, it's overwhelming. It quickly becomes overwhelming.
Tara, have you had a conversation with your fiance about it without, maybe that's a personal question, so feel free to avoid the topic, but.
No, it's not too personal for me personally, and I don't want this to be a judgment on anybody else and what they choose to do. But for me personally, I made a decision early on that it felt unethical to bring a child into the world knowing that their first few years of life would probably be really traumatic, that I would be leaving them probably really young, and that my partner, David's time would be split. How does he support me with what I'm going through and a child? So that was something. I've seen people have kids with metastatic disease, and I think that's beautiful. But for me, that was kind of where my brain has been from the beginning. And David was always kind of, yeah, if my partner wants kids, I'll have kids, but it's not kind of the top priority for him.
And was that a decision that came to you easily, just sort of in your gut? you felt like this was the right thing, or did you struggle with it?
I think I struggled with it a little bit. Like when I met, all my friends are having kids or have recently had kids, and, we would all hang out together and they're all talking about their fertility stuff and the ovulation tracking and all of that. And like, it was really hard to listen to. Before cancer, I thought I didn't want kids, but once you're faced with like the inability to have them, it kind of changed things for me. But I think from the very beginning, I just could never imagine like having a kid and choosing to put them through what I'm going through.
Yeah, it's complex. It's hard.
It really is. There's so many things to think about.
Catherine, from a supporter standpoint, what do we need to be thinking about if we're supporting someone that's going through this decision-making process? What have you found something to be helpful?
Yeah, there's a couple of things I'll say there, and it depends on what kind of a support person you are, right? A family member, or sister or brother or a friend is in a little bit of a different position than a partner or someone who would be the future parent as well, co-parent. For the partner, and sort of thinking through joint family building decisions, I think part of the challenge is to really balance being there for the patient, the survivor, understanding that these are complex, difficult things to think through. They're overwhelming. It's emotional. Often, I always kind of say with my patients going through cancer, what I've come to realize, or my belief is that some of the three, I kind of have the three top most difficult things to deal with are the uncertainty. What's going to happen? How is this going to look? How is it all going to unfold? The lack of control. I don't have control over what's happening to me, over my body or what my life is looking like, right? And then feeling the isolation. I'm the only one going through this, or nobody quite understands, and people love me, but they don't get it, And that's really hard. And it's almost impossible for somebody who hasn't been through it to fully grasp that. But I think just knowing the limitations and being there to provide support anyway, knowing how complex and difficult and overwhelming it is. And at the same time, as a partner, recognizing you're also going through a cancer experience, right? And this may not be what you thought. And there's uncertainty and lack of control and isolation in that experience as well. So also being in touch with yourself and your needs and what you need for support as well. We talk a lot about caregiver support, caregiver burnout, just recognizing what your experience is. And I think it's hard to balance that maybe that's sometimes too hard. But being honest with yourself. And again, as we think about decisions specifically, I always come back to, personal values, priorities, and goals, and wanting to support your partner and being really clear on what they are for you. And that doesn't mean that you don't negotiate and compromise, but just sort of giving yourself space for having those thoughts and having those, your own personal belief system and desires. Does that make sense? Or does that hit home for you guys?
Absolutely, yes. Yeah. Your top three most difficult things, like preach, that's absolutely it.
It's so hard.
Yeah. And the caregiver burnout is so, so real. And that's something that like I, as a patient, am constantly trying to juggle, because I know David is not going to feel comfortable telling me, hey, I'm really burnt out on taking care of you. And so I try and find time to schedule that, like, hey, I'm going to be out with my friends. Why don't you do something for yourself today? And, having conversations of how are you feeling? No, but really, how are you feeling? Right. And really kind of coaxing it out of someone.
Yeah. And sort of quick tangent on that note, finding resources before you hit the burnout.
Yes.
Right? So finding resources, whether it's resources online or groups that you follow, social media, whatever you can connect to. And it's okay for your partner or the patient to not be your support person, right? Like that makes a lot of sense that you don't want to share it with them. But then who are you sharing it with? Who are you connecting with to support you through that? And finding those resources when you still have some bandwidth, so that when you're in the trenches, they're already there and they're already in place.
Yeah, I think that's huge. The first time I experienced progression, David had none of that, because I had never experienced progression before. I was doing great. We really thought we were fine. And it took a while to kind of figure out, okay, what support works for me? What don't I like? And while you're in crisis, that's 10 times harder, right? And you have less time because you're probably going into more appointments and things like that. So even if it's like, oh, I don't need a support group, that's fine. Just get on their email list.
Yeah,
What's it going to hurt?
Keep your finger on the pulse, or, keep tabs on them.
Right.
As soon as you're in a crisis, not only are you busy, but you're probably not sleeping as well, right? Anxiety levels are already high. I mean, all this. Yeah.
Absolutely. So I would love to hear a little bit about the Roadmap to Parenthood resource that you created to help improve this experience.
Yeah, thank you. I'd love to share about it. And I'd like to start again, if you don't mind, with the long version. We'll go back 10 years where this all started, where I was first working with that fertility nurse, and we were saying, what are people going through in the post-treatment survivorship space? And post-treatment is a weird word sometimes, whether or not there's no true post-cancer. But anyway, when you're sort of done with active primary treatment. So we did a survey study at that point. And we were just at the start of this, asked a whole bunch of questions of what were people's experiences, in connection to their cancer care and conversations they had with their providers. Like you were saying in my bio, what were their unmet needs? What did they want? Were they struggling with decisions around fertility and family building? If so, what kinds of support did they want? I think that survey, we had about 350 people complete that survey. And I should say a lot of this research does focus on the experiences of women or, people assigned female at birth, simply because reproduction is just sort of a lot more complicated than it is for women. It's not to say that men aren't important and shouldn't also be having these conversations and provided support, but my research has focused a lot on the experiences of women. Basically with that survey, it's a survey, so we can't get into too much detail with really, how people are dealing with this on a personal basis. But broad strokes, we identified that there were huge rates of unmet need, high rates of feeling uninformed about what their options were, a lack of feeling like they understood their personal values, priorities, and goals, feeling uncertain about values, feeling unsupported, like they wanted more emotional support and they needed more guidance for making these decisions. So we followed that up, and then instead of doing sort of broad stroke surveys, we did qualitative interviews, one-on-one individual interviews. We did more surveys along the way to kind of hone in on some stuff. But when we did those interviews, there we could really dive into details, like what was your experience? What do you wish happened? What do you wish providers had done for you? What are the kinds of support you wish you had as you're going through this experience? And it was really interesting. So there's a number of things, and I think we wrote a paper on this. I think there were 6 points, more access to information, financial support or access to financial information, peer support. There's a number of things you would think. But one that really struck out was asking for help with decisions, but also asking for a resource that they could use in their own time outside of the doctor's office, right? So this is an emotional topic. Everybody has their own timeline for when they feel ready to think about it, ready to think about their future again, right? You're sort of in this whirlwind when you go through cancer. The rug gets pulled out from under you and life gets shaken up and you have to get your feet under you again. So everyone has their own timeline, and people really wanted a resource they could go to that they trusted, that in their own time, they could digest the information and feel prepared for those doctor visits. So sort of an outside resource to say, what questions should I ask? How do I feel prepared for this visit? And to take charge of my fertility and family building journey. So based on that, we developed this resource. And so it's a website, and we call it a decision aid and planning tool. And so it walks people through some of the information that you need to know, both in terms of the ways that cancer treatment might have affected your fertility and your reproductive health, and all of the family building options. again, whether that's using reproductive medicine to, for the patient to get pregnant or the survivor to get pregnant, or a surrogate using fresh, frozen, or donor gametes, using fresh, frozen, or donor gametes with a surrogate, thinking about adoption, thinking about fostering. So sort of all of the information that's sort of a starting place, right? This is not, we didn't want to overwhelm people with information, but sort of a starting place for these are some options for alternative family building. And then a lot of ideas around what we call next steps or ways to plan and prepare for the future. So we have lists of questions to not only ask an oncologist or cancer care team, but questions to bring to your primary care doctor, questions to bring to your gynecologist, because a lot of these, beginning tests or beginning evaluations to be done to just evaluate where you are in terms of your fertility and reproductive health, you don't have to go to your cancer doctor for, You also don't need to go to a fertility specialist for, which is an important point because insurance often doesn't cover those visits, right? So what are all the things you need to be thinking about medically to just be evaluated and to learn your options, medically speaking? How do you talk to a partner about this? How do you talk to friends and family? How do you get the support you need? How do you plan financially, right? So we have information on the costs of different options, but also tips and tricks and how to plan financially for what might lie ahead. We have a whole exercise. It's sort of a 4-step decision-making, a 4-step like evaluation of where you are in your decision-making process. What do you need at this point? Like, do you have enough information to make a decision? There's an exercise to help you clarify your values, right? I keep saying values, priorities, goals, right? But what are they? It's hard to figure out sometimes. What matters most to me, right? And sometimes multiple things matter most. And how do I align those with my partner if there's a partner? And then we have a whole lot of patient stories of those who have gone through different family building options. And then last but not least, and maybe this is the most helpful part of it, is just resources. So when you're feeling ready and in your own time and you're ready to have more in-depth information, here's where to go. Here's the trusted places to get more in-depth information, depending on where you are and the topic that you're interested in. So that's the resource. It's a website. We've pilot tested it now across 2 different studies, and we've had really great results. Again, this is for women and those assigned female at birth, but in sort of pre-post surveys telling us they feel more informed, they feel more confident in being able to manage these issues. Interestingly enough, there was a decrease in levels of reproductive distress or, feeling worried about fertility, but not significant. There's sort of a flat curve, but there was more confidence in being able to manage those negative emotions, which I think is totally appropriate, right? It's okay to be upset about this. We're not trying to eliminate anxiety or eliminate distress. That's not realistic. And it's frankly maybe not even helpful, right? Like some of those emotions are important, but I do want you to feel supported and confident that you can manage them, right? So that was important. We also sort of had some outcomes where we had improved confidence in being able to talk to providers. So anyway, so we got, fairly good results and felt pretty good that this was a helpful resource. And then based on those findings, we got a grant from the NCI. So this is a 5-year grant to test it in a larger trial. And so that's the research we're running right now. And I apologize if I jumped ahead. I don't know if you asked that question.
No, all of that sounds incredible and like something that should have existed a very, very long time ago. And I'm so glad that this is happening and working well. I feel like I would love a guide like that for just about every oncology topic.
Yeah.
So yeah, that is, I love that.
Yeah, thank you so much. And the title of it came straight from one of our participants, one of our survivors, who was like, when you look at Survivor, I think the exact quote, when you look at survivors, give them a roadmap. Tell them what's ahead, give them guidance, right? And so that's what we set out to do. And again, we hope it's helpful. Importantly, it's not supposed to solve all problems, right? And it's the starting point. So we hope to connect you with what your next step is. And you can always come back, right? If you start one journey and you hit a roadblock, come back, rethink things, get resources in different ways. So it's not the be all end all. Some people will need more support. Some people should connect with a therapist, connect with a counselor to think through these topics. But it's a starting point.
Very comprehensive tool. I like it. Is it available? Like if somebody is looking to utilize this, is there a way that they can participate or get access?
So unfortunately, the tool is not public yet because it's still sort of being tested. We hope it will be available soon. Like we can test it, make sure it's helpful and not harmful. And, then it will be publicly available through Stanford. Right now, the only way to get access to it is to participate in our trial. And we'll include a link to the website where you can get information about that and sign up and see if you're eligible. So that's how you can get access. But again, we very much hope that in the near future, it will be publicly available.
Awesome. Nice. Will you be posting updates about it anywhere in particular if somebody's listening to this a year from now and curious to see if it's available now?
Yeah, absolutely. So we have a very small fledgling social media account for the study. We maybe have like 3 followers, but we'll post there. We also have a study website. It might be under sort of review board at Stanford right now, but it will be public. We'll have updates there. We expect to run this trial for the next 2 to 3 years. So it is a long process. It'll be a fairly big study. We're hoping to enroll 250 women. But, we hope people will be interested and enroll. We hope we have, positive findings and it'll be available, and we'll be posting updates all along the way. And,
Awesome.
We can include all of that information in the caption for this.
Definitely. So once again, if you want to participate, you can go to roadmaptoparenthood.stanford.edu, or you can just click on the link in the show notes there that Catherine graciously provided with us. So Catherine, final question for you. Through your experience, what does great support look like?
I'm going to come back to my answer, thinking through support partners. I think great support really looks like being open and willing to listen to what people are going through, what they're feeling, what their experience is, being patient with that, being willing to sit in uncomfortable spaces sometimes to hold space for people, and understanding that these things are overwhelming and complex and that they are not easily figured out, right? That it takes time, sometimes years, right? And often I'm working on with my patients, the medical system is all set up. The message it sends is that when you sort of walk out the doors or you're done with your treatment plan, you're done, you're back to normal. Come back and see us in 3 months, come back and see us in 6 months, go back and be quote unquote normal. And the culture is set up that way too. All of your friends they understand what it is to be actively sick, right? Or actively in the hospital room. They don't understand what it's like to be back in life, living your life, but as a cancer survivor or as a cancer patient, and navigating those changes, changes in identity, changes in your body, and figuring all that out. So holding space that this is a long-term journey. It's overwhelming, it's complicated for all involved, and to let people live that truth, right? And to understand, too many of my patients, their friends will say, and it's with all good intention, but it's saying like, well, at least you're alive, or at least you're done, and that's not what we need. We just need to hold space to hear what they're going through, and validate that even when it's difficult to sit in that. I think that for me is what it means. And I'm probably missing some big important points there, but at the heart of it, holding space for people to be in their truth, right?
That's huge. Absolutely.
Yeah.
Well, this was a great conversation, Catherine. Thanks so much for spending so much time with us, doing the research that you're doing, creating the resource that you're creating. I can't wait for it to get access and publicly available for so many people. Yeah. So thanks again for all the work you've been doing.
Thank you so much for having me. This was so fun. And, it's an honor to come talk to you guys.